everybody. I'm Mackenzie, and we are here with Windsor today. I don't know why I did it like this. It's like this way, I think.
Yeah.
We're so excited to have her. Windsor, you just want to kind of introduce yourself really quick?
Yeah, my name is Windsor Flynn. I am on the board of Made of Millions. If you haven't heard of Made of Millions, it's a really cool not-for-profit that is working on changing the way that people view mental health and how they access treatment. I also do some advocating or normalizing of OCD on the side. Yeah.
Lots. The best.
Yeah, so that's it. And I have 2 kids, and I'm just here to talk about OCD.
Well, I'm so glad you're here. You know, you're one of my favorite people in the whole wide world. So I was telling Windsor earlier, y'all, I'm totally in my pajamas. Don't judge me. I always say I'm going to get cute, and then I'm like, oh, mom life. So
isn't it like bedtime where you are?
Kids, yeah, it's 1 o'clock. So daddy daycare is going on downstairs. Montana has to survive for an hour. We'll see how it goes.
Yeah,
we already have some questions, so I'm going to pull up the first one. And y'all, I'm not even going to attempt to say names because I feel like usernames are so hard to like say. So,
yeah.
Would you consider ERP for the top of your hierarchy the hardest or one of the hardest things you've done? I'm having a really hard time doing mine. Windsor?
I mean, I want to clarify the question a little bit. So ERP, is the question, is ERP the hardest thing?
Yeah, I think I've
ever done in my life, or is the top tier ERP exposure the hardest thing?
I think they're asking if their top tier hierarchy is the hardest thing they've ever done in their life. I'm pretty sure.
Oh, I don't think so, but it sure feels like it is at the time. I mean, that's the whole point, right? Because you're creating your hierarchy as a system that you're going to face your fears in. So you have your list from high to low, and you're going to start at your lowest point because you want your exposures to be successful. And by successful, that means you feel empowered, you feel like you could do it again, and you're able to resist, at least for a partial time, resist or delay your compulsions around that obsession. So when you're at the top level of your hierarchy, it's supposed to be hard, right? Because for people with OCD, a lot of the time, the part of their life that OCD has latched onto has become the hardest. So when you're talking about an exposure for that particular area in your life, yeah, it's going to be hard. It's going to feel like one of the hardest things you've ever done. But you just, you got to do it. And you have to remember that you're the one in control of doing this ERP. You're not doing it for your therapist, right? You're doing it for you. So if your top level is super hard, so hard, and you don't want to do it, the only person that says you have to do it is you. And your motivation for doing that should be not to please your therapist, not to win in recovery, not to be the best at ERP, but it should be because being able to do that and getting through those moments is going to improve your life in a major way, right? That's the whole goal of therapy. It's not to you're not getting points from your therapist. It's just, is my life going to be better because of this? If yes, sure. If not so much, then maybe you don't need to do it.
Yeah, I agree. I think in the moment, it probably seems like the hardest thing you've ever done in your life. Is it really? I don't know. I guess that's, it just depends on the person. But I think that for me, especially if I was I know in ERP therapy, we make a hierarchy, right? But I feel like my hierarchy is ever changing. I feel like on any given day, my top tier could be something else. Does that make sense?
Yeah, totally.
Yeah. But I think in that moment when the anxiety is high and you're anticipating it, it does probably feel like the hardest thing in your life. But once you realize it starts to fall and you complete the exposure response prevention, it doesn't seem so bad anymore. But in the moment, of course, OCD is going to make us feel like it's the hardest, scariest thing we've ever done. So, what are some guidelines for practicing patience with yourself? I feel like I keep getting discouraged when I have a setback. Windsor, you are the queen of mindfulness. So let's.
Yeah, so I like to think about patience as a form of compassion. And when you have a mental illness and when you have OCD, just even if you don't in life, it's really important to treat yourself with the same sort of compassion that you would treat other people. So if, like, say you have a really good friend who's struggling and maybe has a relapse of some sort, either with addiction or with a mental health condition, are you going to come at that person in a demeaning, judgmental way, or are you going to come to them with support and compassion, which means treating them with kindness and respect, and also, like you said, patience? So I feel like when you're talking about yourself, you have to give yourself the same treatment that you would give the people that you love in your life. And that's what I keep remembering. OCD likes to paint this picture that everything has to be a certain way, right? And we have to behave perfectly. That's why it's there's like a lot of rules and control around it, but there's no way to be perfect. And you have to remember that, especially in your recovery process.
Yeah, I think that was an awesome answer, because I struggle a lot with self-love, self-care. And I think it's really important because you can't pour from an empty cup. And I think it's important to remember that, it is a mental health disorder and it's not easy. And if it were easy, there wouldn't be ERP therapy. It wouldn't be hard, and so to give yourself grace, because it is hard.
Mm-hmm.
So, somebody said, "Is this working?" I think that's because we were like 2 minutes late.
Yeah.
I have been suffering from depression and intrusive thoughts about my relationship OCD. I'm scared of recovery because I think it will tell me to leave the person I am with. How do I heal?
Do you have anything to say? I have something to say.
Go ahead.
So I can totally relate to this. I've been in a long-term relationship. I'm married. Everyone knows that's hard too. Like, relationship OCD is really hard and it likes to be certain about things. So being scared that you might have to leave the person that you're with, I feel like, is really normal, but that's also just another thing to be uncertain about. So I don't think this is going to be really helpful or like the best answer that anyone would want to hear, but healing from OCD is about being able to tolerate uncertainty and just accepting that uncertainty is a part of life. So yeah, maybe you go to help your relationship OCD and you realize that it's not relationship OCD, that it's probably just maybe the wrong relationship or the wrong person for you. And that could be a possibility. That's a real possibility. And part of OCD is accepting that there are other possibilities out there and you can't always predict what's going to happen. So moving forward with that, it's just one of those things that, I don't know, you have to like find it within yourself to like balance the two, right? Do I care more about staying in this relationship at all costs, or can I risk losing this relationship if it means that I'm working towards bettering my mental health?
Yeah, I think that's so true. And I think it's important to point out that being married or being in a relationship, like, it doesn't keep you safe from failure from a relationship. And OCD or not, relationships can fail. They fail all the time. And I don't struggle with relationship OCD with my husband. I do more with my friends, but still, I mean, there's so much uncertainty around our relationship. You know, I wonder a lot, like, well, I might wake up one day and Montana will be like, you know what, I've had enough. I can't live like this anymore. And I love you, but I can't, you know, and that's just something I have to live with. And maybe it will happen. I don't know. For now, he's still here, but there's so much, you know, uncertainty around life. And then when you throw OCD into the mix, it's there too. And I think, yeah, like Windsor said, you just kind of have to stay with it.
Yeah, relationship OCD is really hard because it feels like some OCD themes or subsets, whatever you want to call it, some content is pretty irrational, but the idea that we need to focus on our relationship so much and we need certainty in our relationships can feel really relevant and important, but that's just because OCD has latched onto that area of certainty in your life.
Yep, for sure. I think when there's like OCD is always going to find somewhere to wiggle its way in. And so when there's any like ounce of truth or, you know, a fight or, you know, disagreement or whatever, OCD is going to take that and run with it. And so when they're, I think I find it harder, like irrational fears, like COVID on a door handle that I've already cleaned. Like, okay, that's irrational. I see that. But when you have an argument with a partner and you're like, oh, I wonder if that time was like too much, you know, and I don't know if this is right. And it's harder to, you know, get out of that because there's that little concrete of truth that you had an argument, where OCD like takes in and it's like, oh, argument, that's the end of everything, you know, or are you the right person? So I think it's hard when there's something for it to, you know, when there's like a grain of truth, not truth.
Yeah.
But, you know,
well, OCD will find a grain of truth in anything, right? Like, I can think of my OCD. It's important to separate. I can think so much FaceTime. I can think, or my OCD thinks, right? So like I just said, I can think of so many reasons why my harm thoughts could come true, but that's really a good helpful tool is to substitute and say my OCD can come up with a lot of reasons. Like anyone around me could say like, no, Windsor's not like the type to be like a crazy like Netflix special, you know, but my OCD could be like, I don't know, like, let me just go down the bullet list because I have a few situations here that I really think are very important and they deserve another look. And maybe you haven't told anyone about these. Like, so, you know what I mean? Like, OCD is going to make everything seem like the risk is much higher.
For sure. Exactly. I agree. I do think you should have your own Netflix special, not for that reason, but, you know, just when doing a new exposure, can it make you feel like you are having more anxiety and intrusive thoughts? Can it also make your other exposures you've already doing harder to do? I'm laughing because yes. Yes.
It's the whole point.
Yeah, it's the whole point. I'm not laughing at you. I'm laughing with you because, you know, it's just one of those things. It is. It's all about getting yourself into that anxiety and sitting with it. And I think Windsor, like we've talked about it before, I think the biggest thing for me for ERP therapy is that it made me self-aware. So I'm aware that anxiety will rise, but it will also fall, where I didn't know that before. And so that anxiety comes on and it's there, and it's almost harder when you know better, right? Like, you know, like it's going to end, but then you're like, oh no, this is so real. I should go back and do this or whatever the case is. But it does make things harder. It does. And when you're trying to think about another exposure in the middle of doing one, those things seem harder and more scary too. What do you think?
Yeah. I mean, new exposures are supposed to trigger you. That's why you do them. So the fact that it causes more anxiety and more intrusive thoughts means it is a good exposure. That's just more opportunity to be able to accept the presence of that anxiety and the presence of those intrusive thoughts. So keep doing what you're doing. That means your exposures are good. And if you need to adjust them, if it's too hard, you can always go low.
Yep.
Make it a little bit less scary.
I have been dealing with ROCD for a long time, and sometimes I think that I don't even have OCD and that I just don't love my significant other anymore. Is that common? Well, I think
Sounds
OCD,
like reassurance.
yes, it does. Yeah. There we go. Windsor's better at the tough love than I am.
Yeah, that's your OCD saying
Yeah.
that maybe I don't have OCD and maybe it's just that I don't love my significant other. And instead of saying, is that, I mean, yeah, that's common. It's common for people with OCD to question their diagnosis and think, well, maybe it's not that at all. And maybe I really am this. Like, I'm just going to keep going back to the harm OCD one because for a lot of people that seems irrational, right? Like relationships seem so relevant and it seems like you need to know, but like some people's OCD really makes them think about harming their babies literally the entire day. And so they get an OCD diagnosis and those mothers, I was one of them, will think, what if I don't have OCD and I really just want to kill my baby? Is that common? Yeah, because OCD is a doubting disorder and it tells you its main goal in life is not to be like, yeah, I have OCD. Let's just figure this out. I don't have a place here. OCD is like, hey, any possibility, I'm there. I'm trying to protect you. So it just sees a diagnosis as another reason why you're not giving enough attention to the thoughts. But really, you don't need to give any attention to the thoughts. So yes, it's common, but I'm not gonna say that it doesn't mean that you don't love your significant other. You might not, but you just have to take that risk and treat your OCD as such.
Yeah, OCD is the doubting disorder. It's like the only disorder that makes you think you might not have the disorder you've been diagnosed with. So, yeah, I think that's good advice, Windsor, as always. I have a therapist, not for OCD specifically, and I'm scared to open up about my struggles to do with what I believe is with my OCD. Any advice on how to start a conversation with my therapist? So, question. This is a question to you, Windsor, kind of off of this, because I feel like this could be a really hard situation because you're in a generalized, like with just kind of generalized counseling or whatever. I don't know if that's like specifically what this situation is, but I always think about that, right? Like, because they're not trained with OCD. They might know about it from a psych class, but I think you run the risk of someone like trying to tell you to like stop your thoughts or, like continue talk therapy if they don't understand what's going on. And so I think that's why it's so important to reach out for like ERP therapy, or if you feel like you might have OCD, especially with OCD, because you can, do a diagnostic assessment with a therapist and kind of go from there. But it would be a scary situation, not scary. It would be hard to try to open up to a therapist that didn't understand, because if you don't know, you're more likely to give the wrong advice, I feel like.
Yeah. And this has happened to me before. And weren't you in therapy for a while too? It wasn't for OCD.
Yeah. Well, when I got diagnosed, it was just over 15 years ago. I got medicine and then I went back to talk therapy. They didn't even, it's like just going to
a psychiatrist.
Understood. Yeah.
Yeah. So that happened to me. I was given horrible advice, but it's not like therapists really don't know anything about OCD. They know it, but a lot of the time, if they don't have a lot of experience with OCD, they might not be able to identify, they'll be able to identify intrusive thoughts and irrational fears and stuff like that, but they may not be able to identify those compulsions. And chances are you don't even know what your compulsions are.
Yeah, I did.
Going in to see a therapist. So I always say you can go to the IOCDF or NoCD website. I'm sure they have something on here about the symptoms and the common subtypes and what compulsions look like and what common obsessions are. And you can take that out or take it out with the computer. You can print it and just like make a note of all your symptoms. And then you can bring it to the therapist so that they have context for what you're talking about. And that would be easier. And you can kind of tell, like, especially if you're following an OCD, if you're following any OCD accounts, I'm sure you know enough about OCD and what the treatment is supposed to be. So depending on what your provider says, you can get a really good idea of if they know what they're talking about or not.
Yeah, that's a good point. Because I've had OCD my entire life, and it wasn't until this year that I realized all these other things were my OCD that it didn't even go into my mind that it was. I think a good example is the downstairs door like flew open the other night. And my mom went and asked, she's like, "Hey, did you open the door by accident?" And I was like, "No." And she was like, "Oh, the wind must have done it." And my OCD like just started spinning. I'm like, "Oh my gosh, what if somebody broke in? They're in the house and they're like, it wasn't the wind. Why would she say it's the wind? Why would that be the first thing?" And then I had to catch myself, and I was like, "Is this OCD? Like, this is so my OCD." And I never knew that before, but like I felt like a kid watching a scary movie. I was like scared to move because all these what ifs were flying through my brain. Sometimes we don't realize all the things going on. I get really avoidant sometimes, and I feel highly anxious near them. My stomach aches and not throwing up. How to deal with that? You want to clarify on that a little more? I don't know like who you mean by they and stuff, but anxiety.
So, I think that to answer the question around like the physical symptoms of anxiety, so stomach aches and nausea are really common symptoms of anxiety. And you can do certain exposures around them, because if you're avoiding certain situations that make you feel nauseated or that give you a stomach ache, you can actually habituate yourself to those symptoms. So you can do things that make you feel like throwing up, like maybe whatever, I don't know, spinning around in circles or something, until you feel a little nauseous, or smelling something that you don't like. That's a good way to habituate to those feelings so that the urge to avoid those situations is not as strong.
Yeah. And as far as physical symptoms with OCD, like if I'm like worried I'm going to get salmonella from something, or like my brain will physically make me feel like I'm not feeling well, like my stomach hurts, or, oh no, I have a headache, whatever symptom I've read, I start to feel like I'm having those physical symptoms. And then I get myself so worked up from the anxiety that I really do have a stomach ache. I really do have feel like I could vomit, but it's not from salmonella. It's because I worked myself into a panic. What OCD did you have? So, Windsor, do you want to?
So everyone has the same kind of OCD. Yeah. Like OCD is what I like to say. But as far as content goes, like the thing that brought me into treatment was intrusive, violent thoughts about, I don't know, just people in my life. So that would be classified as like harm OCD, but it's affected multiple areas, and I've had obsessions ranging from A to Z, you name it.
Yeah, I'm not a big fan of themes in this context because, like Windsor said, OCD is OCD. And I feel like some themes stigmatize themselves a lot, and then it kind of contributes to the stigma that surrounds mental health. And my OCD has jumped all over the place. So I guess if I was going to say my biggest subtype is contamination OCD, but I struggle in lots of places. Mm-hmm. That seems to be my biggest one. Are you able to discuss intrusive thoughts when it comes to harm and Puro? You mean just like, you think like what some of your examples of intrusive thoughts were, Windsor? Is that?
Oh, I don't want to get into too much detail. I just don't think it's like,
it's not beneficial,
super necessary. Because I feel like there's a few reasons to ask the question. Sometimes people ask this question because they are looking for their same obsession or intrusive thought. And if another person with OCD has it, then that means they don't need to worry about it. It's a normal intrusive thought to have. It doesn't mean anything. So, and it could be a reassurance seeking question, whether you know it or not. And also, it's just like,
it's irrelevant, really, because
it doesn't matter, because that's not even the point of, that's not how someone could tell if someone had OCD or not, because anyone can have a thought about anything, but it's the pattern of thinking and the behaviors that come after the thought that define whether or not a person has OCD.
Yeah, and I don't mean it to sound harsh when I say it's irrelevant, but you could have any thought in the world. You know, sometimes they're, especially with contamination OCD, there tend to be main thoughts like cancer or whatever the case is, but you could have an intrusive thought about anything. And so I think I agree with Windsor that, you know, answering it kind of for what it is would kind of be giving into reassurance, I feel like, a little bit.
Yeah. I mean, and there's also common types like, you know, like violence, pedophilia, sexual intrusive thoughts about like animals or even family members, or whether or not you're a narcissist, or it can go into like, do I have this mental disorder or not, or do I have this physical illness or not? You know, there's like always common contamination. They're just right, perfectionism, OCD, there's that kind of stuff. But when you get into the actual thought itself, it's like, doesn't really matter.
It's pretty funny. Not funny. It's nothing about it as well. I mean, I laugh at mine a lot, but I was talking to Montana, my husband, about it the other day, and I don't know, like something about tetanus popped up into my head, and I was like, oh shit, like, do I have my tetanus up to date? And like, I was freaking out in my head, and I was like, oh, I do, because you get a Tdap shot when you're pregnant. And I was like, yes, like, got it. Okay. And he was like, do you just pull random like salmonella, tetanus? I was like, you know what? What's really funny is people that suffer with contamination OCD like thoughts, like really those tend to be like, it's so crazy to me how OCD like pulls from those same thoughts for people, you know, like tetanus or salmonella or cancer or whatever it is. I was reading an article and it was like years ago for OCD, for contamination, it was like AIDS. That seemed to be what kind of was. And then it was like cancer, and then it's COVID. And like, it just seems like, I guess it's whatever is kind of relevant.
It's like the times, like now, especially that the internet is like super all about narcissists. Did you notice that?
Yes, I did.
It's like a super common one too. Or am I going to be canceled? Am I trans?
Oh, cancel culture with my OCD like scares the bejeebies out of me. Like, I'm just so afraid I'm always going to say the wrong thing. Like, I don't know. I'm like, oh no. But my OCD like takes it and runs with it. So I think Chrissy did a post all about cancel culture and OCD, I think a couple of months ago. But yeah, it just kind of latches on to everything. Hi, Tori. Oh, sorry, y'all. My thing just jumped all the way. My OCD intrusive thoughts started after seeing someone post their harm story. Now I worry if I actually harmed someone in the past and can't remember.
Maybe.
I can always count on you to do the like tough love part. I like think it in my head and I'm like, all right, I'm going to wait for Windsor.
No, it's really common to be triggered by something that you read or have seen in the media.
Yeah, I will say that, like I said, my biggest theme has always been contamination. And I was like, you know, it jumps into different themes, but never as strong. And mine a couple of months ago, like jumped to a theme that was like really strong. I was like, wow, like OCD is really coming at me right now. Like this one has never bothered me like this before. Why is it, you know, I mean, it's going to get you any way it can.
Any way it can. Like, I'll agree with Mackenzie. You know, I've had like thoughts of contamination OCD in the past, but it's been like years and years. And I don't know if you remember, Mackenzie, but I texted you a few months ago, like, all out of nowhere, I was like crying on my kitchen floor about this piece of meat because I was worried that it was contaminated.
Mm-hmm.
And it wasn't even about if it was contaminated or not, but it was the fact that I felt so unsure about whether or not it was contaminated. And how would I know if I was sure or not? Because I can't trust my gut. And then now what am I supposed to do with the meat? Because I just don't even know. And I was like crying about meat poisoning, but that's like typically not my content. So it was really bizarre.
Isn't it? Like when all of a sudden this one that doesn't bother you that often, it's like, I see you. Like, I'm coming for you today.
I see a weak moment, and here it is. You're a little bit stressed. There's no one around you to ask. You can't, your husband's annoyed at you, so you can't even text him about the meat. You just have to figure this out by yourself. And I was like, oh, I don't know.
Yeah. And how you said, like, trust your gut. You can't trust your gut. Like, okay. Like, I think it's important to say, like, being in like recovery or having gone through ERP, like that doesn't mean that we don't have bad days or bad weeks sometimes. And I was in tears the other day because I was like I have this funny feeling. And I'm like, what the fuck does that even mean? I can't have a funny feeling. I can't feel like something's off because I can't trust my own gut. Like what does it mean exactly when I say I have this funny feeling? I can't shake it. I just have this weird feeling, because you'll like see on the news. This is about the break-in thing. So you'll see on the news and they're like, oh, I just knew, like I had this weird feeling, something felt off and I knew. So I checked the house and what do you know? Like someone broke in and I'm like, I can't even fucking do that. Like, I'm sorry, I just said that word. I can't do that. I can't just have a feeling and know because I don't know. I really don't. And I just think, and I've got, like it's just one of those like frustrating. Have I gotten better about trusting my gut? Like, yeah, but I'm like, what? It must be like nice. So like, no, I had this funny feeling and I was right, because I have a funny feeling.
I think about that often. I'm like, oh, you just knew. Did you? Well, I just know a lot of things. And none of them have been true. Except like a few times. But those few times are like, okay, we've gotten like a little off track, but trusting your gut is really hard with OCD. But the more that you practice with it and the more that you can recognize that sense of urgency, you can separate what's OCD and what is actually intuition. Intuition feels a lot less, not important, but a lot less urgent. And it's like a deep knowing over a long period of time, whereas OCD is like, you just know it all of a sudden and you need to act on it now. Like intuition, you don't really have to act on it now because intuition is not the same as like a fortune telling device or like an alarm system. Your intuition is not going to like, I don't know, I'm not a psychic, but like typically your intuition is not like, oh no, something's going to happen in 5, 4, 3, 2, 1. It's more like, I don't know if this is the right job for me. I feel like my intuition is telling me I want to explore more. You know what I mean? Something like that. It's not like there's a robber in your living room. I just know it.
I just know it. Yeah, no, that made me. Have you ever seen Bridesmaids and they're like, did you do? That's what I want to be like when people are like, I just had a feeling. I'm like, oh yeah, you did.
That's how I feel all the time. I'm like, ugh.
Must be nice. I'm just kidding. Any point during ERP did you feel stuck? My harm OCD and relationship OCD haven't bothered me as much, but I feel stuck on obsessing over how I'm responding to my thoughts, like maybe, maybe not, or ignore them. Yeah, OCD makes me feel stuck all the time. I get stuck lots of times, especially. What do you think, Windsor?
I feel like, I mean, I'm not a therapist or anything, but if your harm or HOCD and ROCD are kind of in the background, it sounds like maybe your OCD has moved on to your treatment responses. Does that make sense? Like if you're obsessing over, if you're doing ERP the right way, responding to your thoughts the right way, that's just another way that OCD is saying, hey, I'm still here. So you could practice you could do ERP around that. Like, maybe I am responding to my thoughts the wrong way, or maybe I'm not doing it right. But like, another answer is ignoring your thoughts. I feel like it's hard to differentiate between the good kind of ignoring, like accepting ignoring or avoiding ignoring. Those are two different things. And you always want to lean more on the acceptance route for thoughts.
Yeah, I think, which by the way, now I've totally meant to say, Windsor and I are not therapists, just in case anyone, we're just advocates, and we like to share our story to make other people feel less alone and more understood. But I think that was good advice. Windsor, you're good at, good at that kind of stuff.
I'm not like, don't take what I say as like, oh, this is what a therapist told me to do. I'm just saying that, reminding you that OCD can move on to literally anything.
Yeah, for sure. Even response from even your treatment. It could, is this even working? Should I stop? All of those things can move to anything. Nothing is off limits. Hi, sometimes it feels like I'm acting on my thoughts and urges by moving my body or parts of my body in certain ways as impulses. This feels so much more than OCD. Thank you. I
don't know what you say. I feel like I know what to say, but I also feel like there's like a limit on any advice that I can give here.
Well, you give it a swing, because I don't know.
But impulses, so there's intrusive thoughts, images, and urges. And sometimes moving your body is just another way of testing that intrusive thought to see if it's something that you're going to do. So even moving your body in a little bit, like could be in your OCD or your brain's automatic response, or what feels like an automatic response of testing the validity of that thought or urge. There's no way for me to tell, right? But people's body does this all the time with like sexual intrusive thoughts, like a groinal response, right? Like you can have a sexual intrusive thought in your groinal area, your private parts, whatever you want to call it, the place that people associate like sexual feelings with will like move or have movement or have sensation in that general area. So if you're thinking of like, for example, harm OCD, like, what if I strangle this person? And you like kind of feel like a movement in your arm, like, oh, maybe what if I move my arm like that? Am I moving my arm? Something like that is like still OCD, And let me just remind you that feeling like you're acting on thoughts and urges is much different from acting on thoughts and urges. Just because you feel like you are doing something doesn't mean that it's actually happening, right? So feeling like you're doing something is completely different from actually having completed and done the act.
That was good. That was good.
So what did it make sense? Is it weird?
No, it makes sense. I got it. Do you guys take medication for your OCD? So I always have. I haven't in a while because of pregnancy and breastfeeding, but I actually just got a referral approved to go back on medication and try a different one. But it's different for everyone. You don't have to.
I haven't, just because when I first sought treatment for OCD, one of my main obsessions and fears was that I would experience psychosis, and I had associated that with trying medicine. Also, there was like some things that happened in my life that made me really scared of medicine. So at the point in my life where I could have probably greatly benefited from medication, I was too scared to take it. So my therapist and I agreed that it would be really hard for me to be able to gauge whether or not the medicine was helping, because my OCD was specifically targeting any side effects from medication at that point.
Yeah. And then it could be dangerous too. I mean, just thinking off the top of my head, like if you're afraid to take medication and you start to take an SSRI and then you
And then
stop
I just don't do it one day, right? It's like really
your levels and everything. But I saw an Instagram post the other day. I can't remember who it was from, but it was like, it's okay if your serotonin is store bought. And I just think that's really funny because,
yeah.
you know, and it's different for everyone. And that's just something that you and your therapist decide together, and you know, you go from there. Can nightmares be a part of OCD? So talking about medication, one of the biggest side effects of an SSRI is, for a lot of people, is nightmares. But I also had very bad nightmares when I started ERP therapy. Windsor, did you?
No.
No?
I mean, I wasn't sleeping really deep, and no, luckily I didn't really have nightmares a lot.
Yeah, but I think you know, OCD can creep in anywhere, so I don't think dreams are off limits either.
Yeah. But yeah, no, if you're thinking about something all day long in your conscious brain, then it makes sense that it would show up in your subconscious brain.
Right. Agreed. Because that's when you can't fight it back in your sleep either. You know, it's just kind of fair game. Makes sense for it to be there too. How has COVID affected your OCD, especially contamination? How do you deal with the realness of it? I'll let you know when I get there. I'm just kidding. No, really. It affected me a lot. I woke up and the world around me, it was like a horror film. At first I was like, this is awesome. Like everyone is just as worried about germs as not COVID is awesome, but the reaction, like masks and hand sanitizer and washing your hands. You know, the world around me was as scared of germs as I was. And so I was like, now everyone's going to be careful. Like, okay, you know, and then
not careful at all.
No, they're not. And it just gives you more to like, did that asshole just pull his mask down and cough? Like, what's the point of the mask? Or like, you're wearing gloves and you're touching everything, but you're not washing your hands in between. So it's the same thing. I don't know, y'all. Like my OCD jumped with everything. But I think the best advice my therapist through OCD gave me was, we decided that I was going to use like the CDC guidelines as my baseline, because irrational and rational got very blurred for me. And I didn't know if I was doing too much, and no one really knew what was too much. You know, we're this week is a year of this crazy year. And no one really knew what too much was or right was. And so when I'm spending 2.5 hours wiping off my groceries, but the CDC isn't saying that you need to wipe off your groceries, that was like like Ken's like, here's where we're supposed to be, like, here's where you are, you know? And so like, that would be how I differentiated and tried to figure out the realness. Like what was, whatever was above the guidelines of the CDC, that was where I knew like, hey, I see you, OCD. Does that make sense?
Yeah, perfect sense.
What about you, Windsor?
Same. I still am like,
I know.
I can't really relax about it, but I just follow the rules because, I mean, it just makes it a lot easier for me to know how my behavior, to be able to measure my behavior. Because I err on the side of caution in many, many ways, and COVID has proved to be no different. And I'm terrified of it. Like, it hits on my obsessions in a lot of ways. So I just have the same plan as Mackenzie, which is to stick by the CDC guidelines. And when I feel extra anxious about something, I just feel extra anxious about it.
Yeah, I think.
I try not to get super weird about it, but it's really hard.
Yeah. My mom will be like, it's really hard to go places with you because you get that like, I get that like OCD stare. Like,
Yeah,
if
like
someone
you're in headlights and then kind of hard to move and people want to talk to you and you're like, don't talk to me. I'm like really focusing on like measuring my risk.
we're at the playground or something and I'm being really careful and someone like just like wipes their nose and then touches the swing and I'm like,
And like, you notice that. I notice everything like that. I'm like, I feel like having OCD, even though it sucks, like I could be really great in the army or in some kind of job, or I had to like pay close attention to,
like you're,
you know what I mean? Like
I
I
would
would
never
know where the noise was coming from, and I would know how far away it was, and I would know what time I heard it. Like I would just know all the things.
Yeah, like, yeah. And it's embarrassing. Like, it's embarrassing when I think about that kind of stuff. Cause like for like other people, you know, like Montana will be like, you're staring at that person. Or like, what are you doing? Like, Kenzie, keep moving. And I'm like, see that? Like, he's like, I can't, like, you know, like, it's one of those things, like, you're so hyper vigilant that you just see everything. Like, who else would see that? Who else would hear that? No, just my OCD. That's it. That's all.
Yeah. I have COVID vigilance too.
Yeah. Right. Like somebody coughs and I'm like,
I wish I didn't have that either. And so like when I made that comment about like my super set of skills, like I would never say that OCD is like cool in any way, but like it really makes you notice a lot of like anything related to your obsession is like, whoa, circled, big red marker.
And then I think everyone else thinks that way too. Not, I know they don't, but like when I went to Trader Joe's with my mom for the first time, like since COVID, I coughed and I was like, I swear to God, that was not a COVID cough. I said it out loud. I was like, that, I don't know what that was. Like, it was like a nervous cough. I don't have COVID.
Everyone's like, what are you talking about?
Who is this crazy?
No, I get nervous to even sniffle out in public. And when my kids do it, I'm like, oh my God, everyone's going to be really worried. Everyone's going to be worried about that. And I just don't think people are.
No, really, nobody cares like we do. I mean, about little things like that, you know. I am facing trouble driving because of my anxiety and OCD. I'm facing my fear, but question is the fear while driving going to occur in every OCD episode, or once this fear is faced, will it go? So I think answering that part would be kind of giving into reassurance a little bit, because I don't know. Maybe it'll go away, maybe it won't. But driving and OCD and anxiety is very common. That's my OCD has jumped to driving, being anxious while driving the past couple weeks. I don't know, you know, you can do it.
It's hard for me because I'm like, I don't know. I hate driving.
I know. I know. My ERP.
You should
let me know how it goes.
Yeah. Like once you master that one, cool.
Mine has never, I just got a blanket hair in my mouth. Ew. I have never had that problem, and goodness gracious, I'm dealing with it now. So I don't feel like I can fairly answer this one. My ERP was to drive at least 5 minutes a day. And I'm doing that. So there's that.
It does get easier because at one time I had like kind of like gone really far in my driving one. But I was doing it every week and it was really hard and I cried a lot in the beginning while I was doing it. But that's one of those things where if I don't do it, which I haven't, I saw this pandemic and I was like, yes, I don't have to go anywhere. And now like driving to new places or driving even places that are close to the freeway that have signs that say freeway, like but that I might accidentally go onto the freeway when I don't want to, I like can't do that. So I'm going to try to do it tomorrow as part of my ERP.
We need to chat. I forgot you have OCD with your driving too, because
I'm
on a struggle bus, no pun intended about a bus, but I'm there. Like, yeah.
It makes me not want to go anywhere because it feels so dangerous because there's like, you know, I don't know. It just, because my OCD has attached to it. So it feels really, really dangerous. But literally people drive all the time. Elderly people drive, like people drive putting their makeup on. People drive stuffing their faces. People drive listening to music and they're like chill. Meanwhile, I'm like, I can't focus.
Yeah. And that's a perfect example of, like recovery isn't the absence of intrusive thoughts or bad days or bad weeks or, it's we have the tools that we didn't have before, but that doesn't mean that we don't have bad days. And I, especially with driving OCD, like I got in the driveway and my anxiety was so high. Like I had like white knuckles and I couldn't, like it hurt to unclench my hands from the steering wheel because I had been like holding on so tight. And that is just something that has never happened to me before. So I don't know if it's going to go away or not.
I think it could go away. I think that anything that you work on with ERP has a really high chance of going away. I was going to give a lot of reassurance, but I'm going to stop myself.
No, do it. Help. My partner is overwhelmed with my OCD and my bad days from OCD. How do I reduce the burden on her so we can stay together? I'm not laughing at you again. My husband is really overwhelmed by me too right now.
There's a book by John Hirschfield. It's called When a Family Member Has OCD. And it explains in like layman's terms, like what to expect from the person in your life who has OCD and appropriate and helpful ways to respond.
Yeah, I think
I highly recommend the book.
Yeah, and a cool thing about no CD also is if you do ERP therapy with no CD, and I don't know how it is for others, but like my husband sat in on ERP therapy with me, and my provider gave him some like tips and tricks on how to best help me. And he's read a couple articles, just kind of some days it's overwhelming. It's overwhelming for us. So it's overwhelming for other people as well. And I think, OCD often is described as a family disorder. And I think that's a very true statement. And there are people that will love you through it, but it is hard. And that was why I started ERP therapy, because I became self-aware that my OCD was affecting more than just me. It was affecting the ones I loved around me also. And I knew I needed to do my best to work on it because I wasn't doing them any good not. And it wasn't fair for me not to. But that was just me. Okay, let me see. Y'all, this blanket hair is now in my throat. I feel it. Windsor.
I used to be so scared of seeing that word. It would like make me flip out for days and weeks. What if OCD is psychotic?
So question, like one time, because this was an example of something that I didn't know was OCD. So like, I feel like all of us kind of have this, but I watched the Truman Show on accident when I was a kid. And like, I was looking for cameras like everywhere. And so then like, as stuff got like, so I was like, oh, I wonder if my life is a bubble, like, and somebody's filming me and this isn't real or whatever. And then I was like, oh, like, oh my gosh, like, am I going nutty? Like, what is, and then I didn't realize like, that's actually the Truman Show in itself is like a huge thing that people struggle with OCD. So is that kind of like along that? I don't know that if that's.
Well, okay, here's the thing with psychosis, and it's like really, it is so highly stigmatized. And I feel like the part of OCD that's scared of psychosis is the part that doesn't really know anything about it. And even if you really do know about psychosis, your OCD can still be attached to it. But OCD is not like typically related to psychosis at all. No. It's not the same thing. It's not close to the same thing. It's not like a thing where if you have OCD, it's going to turn into something else. You know what I mean?
Yeah, no, I just mean like, is that like when people, would that be an example of when people that actually have OCD feel like a, because I feel like a lot of people say like, I'm worried that it's not OCD. I worry like that it's something more, because you start to feel that like paranoid feeling. And that I think there's this like, right, like it's not psychosis, but like OCD makes me paranoid, like with
I think that's like a trigger for people too, where you notice that if I have an intrusive thought about something, I get this thought of, wait, am I paranoid? What if I'm paranoid? Oh no, paranoia is a sign of blah, blah, blah.
Right.
And then that's how I tie into, like I tie my OCD into like a lot of different disorders, but it's just that you're scared of it. And also, I don't know, I feel like a lot of people are scared of psychosis too.
All right, we have time for one more question. I feel bad because there's so many, so if we missed you, please don't take it.
That's good that there's so many questions.
They're like, really, from the time we started till now, we've just been answering all these questions, which somebody said we're so good at answering questions. So thank you for that. Okay, so we'll do this one. Could OCD change your feelings for a long time, like feeling angry, sad, disgusted about something for 2 weeks or anything like that? So I just want to say quickly, like, before ERP therapy, before I realized that my anxiety would rise and fall, I could get stuck on something and be worried about something for a long time, like days, weeks. I would just, my anxiety would still rise and fall because that's natural, but I would knock it back up again and again and again.
Mm-hmm.
And the response prevention part, I didn't know how to do, and so I think one of the biggest changes I've seen while doing ERP therapy is that my OCD, that those thoughts, and that anxiety state, that doesn't stay as long as it used to. Does that make sense?
Yeah, totally.
What do you think? Same.
I think that it can heighten feelings for sure. For me, I don't know if it like makes me feel different things, but it definitely puts a highlighter on emotions or feelings that I find harder to experience.
Yeah.
So, like if I feel mad about something, I might think about how I was mad about that for a while, or I might,
a conversation you had with someone, you think about it for
yeah.
Yeah.
But I don't know if it like it necessarily makes me think of something. I don't know. I think that's just OCD is also really different for everybody.
Mm-hmm.
But if the question is like about like some symptoms of OCD, I don't know if it heightens emotions or feelings or anything like that, but it definitely makes certain feelings feel intolerable.
Yeah. Well, with that being said, somebody asked about the NoCD app and they said it looks good. So I just want to throw out there quickly. You can download the NoCD app. You don't have to be actively in ERP therapy to download the app. It serves as like a community. There's a bunch of OCD warriors on there, and there are community groups that are hosted by NoCD providers. All sorts of good stuff on there. If you are going through ERP therapy with NoCD, you can also talk to your provider through the app. But you can go to treatmyocd.com and schedule a free call to speak with an intake specialist, and they go over how the process works, the cost, all of those things. And that is, again, treatmyocd.com. Windsor, I just want to say thank you so much.
I'm so excited to see you. I never get to see you.
No, and Windsor and I are going to do these every Thursday for the month of, I almost said November. It's March. The month of March. So we will be back on Thursday at 7 Central, 8 Eastern, 5
Pacific.
And we are super excited to see you guys then. So bring your questions. Thank you guys so much.
Bye.
Bye.